And now we come to the treatment, which I love so much, and I do it in my clinic nearly every day. And it's so handy, so simple, and so beautiful. It relates to meridians, gallbladder and liver. This treatment we call heat treatment, and it works for any heat condition. It can be empty heat, it can be full heat, it can be low-grade temperature, any rash, any skin disorders. Even if the person doesn't have temperature as such, but the skin is red, heat treatment works beautifully. People who are hot flashes, for example, they come into my clinic, I put the needles, in 5 minutes, 10 minutes, they ask for a blanket. So which meridians are responsible for heat or fire in Chinese medicine? What is fire in Chinese medicine? Fire. So wood. Small intestine and heart. Would you agree? So to work with fire, we put two elements as heart and small intestine on the top. Are they related? Yes, by system 3. If there is system 3, so either that will be structure A or structure D. I will tell you that will be structure D, because we would like to invite from one side gallbladder and from another side liver. And this is the heat treatment. How to use it? You can definitely use Ashi points, but for heat treatment, very effective is meridian conversion. I will give you the points. Heart 3 and 7, small intestine 3 and 8, gallbladder 34, 41, and liver 3 and 8. And you start needling. How we put needles? Dr. Tan used to say that it's not important. The sequence is not important. To me, sequence is important because Dr. Chao Cheng taught put needles in a certain way. How we do it? We start needling the meridian, which is, we think, is a primary meridian related to this particular problem. For example, we can start needling small intestine, for example, and we start from more distal point 3, and then we go to more proximal 8, small intestine. And from this limb, then we go clockwise. So clockwise, we go into liver. More distal will be liver 3, more proximal will be liver 8. From here, we go clockwise to gallbladder, and we needle 41, 34. So, and from here, we needle heart 7, and more proximal heart 3. This is the general rule for needling using gallbladder global balance. Or even in local balance, I prefer start needling from the more distal point and go towards proximal. In case of low-grade fever, for example, if the fever starts 12 o'clock in the afternoon, try to invite the patient just 1 hour before the fever starts. You would need a few treatments, and then you will see that the fever either subsided or just disappeared. So just slowly. That works so well. Also, you may remember from local balance how to reduce any heat or fever.
Small intestine 3.
Small intestine 1. The best point, you just needle small intestine 1, adjusting it to any pattern. For example, someone came from general cold, but too much heat. You add small intestine 1 to which corner? To the yang corner. Just small intestine 1. One needle. That will work so good. Hot flashes. You do this treatment twice a week, regular. What else you can do for hot flashes? When woman is in menopause, the kidneys have lower energy. You can add, for example, kidney 7 to the right corner, or kidney 247. I recently had a patient, she suffered from hot flashes, very severe hot flashes. I did heat treatment, she felt better. But then on the third treatment, I added kidney 247. She said she slept so well, she didn't woken up, she didn't have even just single flash for the whole day. Beautiful. These patterns is so easy to remember if you have a system how to remember these patterns. It was a big problem for me because Dr. Tan gave it as such, just everything together. So we had to put it into kind of some of framework to remember them better, so we could address this treatment accordingly and quickly and fast. So with this sequence is all clear. Digestive 1, digestive 2, digestive 3, digestive 4 with edema. Digestive 1 general use, digestive 2 a bit nervous, digestive 3 tired, water retention, digestive. Du Ying Shao Yang is a bit digestive because pericardio treats stomach, so it's related to digestive disorder. Shao Yin, Shao Yang, more ego, more tired. Hormonal,